Welcome. My name's Ron Clemmer. I serve as the Secretariat Director for the Global Handwashing Partnership. And we're just thrilled to have you here today. We're always thrilled on Global Handwashing Day. And our theme and slogan for Global Handwashing Day this year is, "Why are clean hands still important?" And I'd like for everybody to think about that, because sometimes we kind of take that for granted. But you know, during COVID, people were very interested in having clean hands, and you couldn't buy soap in some grocery stores because all of the soap was sold out. And after COVID, things went back to normal a little bit, and maybe less focus on hand washing. But you know, still with diarrheal diseases, whether it's an inconvenience or life-threatening, there's no better prevention than hand washing with soap. And respiratory diseases, whether it's a annoying cold, or it's the flu or pneumonia. So anywhere, again, from annoyance to life-threatening, you know, it's a great prevention of hand washing with soap. So we know all of these health threats, but you know, every day you see in the paper where there's more and more health threats for us to be concerned about. And with these emerging diseases and emerging infections, again, we're finding this basic barrier of hand washing with soap to be effective. And that's true whether it's in the community, which is helping to fight against antimicrobial resistance, or if it's in the healthcare facilities, where we're trying to prevent healthcare associated infections. And I mentioned the Global Handwashing Partnership. I'm going to do a very brief history of some highlights of hand washing. You know, it was back in the 1800s where it became very clear how important hand washing was for prevention of the spread of disease. And then skip forward more than 100 years, and then 2001, some of our colleagues formed the Public-Private Partnership for Hand Washing, because they saw a need for a real focus on this critical area. And eventually the name changed to the Global Handwashing Partnership, but we still have that foundation and that focus as a public-private partnership. And then in 2008, some of our colleagues founded Global Handwashing Day. And so now, every year on October 15th, we have this great day to celebrate the benefits of hand washing, but also think about the commitments that all of us and all of our organizations need to make so that everyone enjoys the benefits of hand washing around the world. And I did want to share our partners within the Global Handwashing Partnership. And you'll meet some representatives from some of these partners in our session today. But it's a partnership that, again, has been around for more than 20 years. And this kind of partnership typically does not last that long. But you know, this is such a critical need in such a critical area, and we fill a void that's not filled elsewhere. To have this focus on hand hygiene and hand washing with soap. But our partners really span that whole system of hand hygiene, from global corporations to small businesses, from research entities down to implementers, from national governments to multilateral organizations, because we're all part of this important system to ensure that people enjoy the benefits of having clean hands. So today, we will be moving forward with some comments from one of our steering committee members, and then we're going to have a presentation on the new WHO UNICEF guidelines on hand hygiene in community settings, which are coming out next year. So we look forward to hearing more about that. And then we're going to have a panel, and again, it's representatives from different parts of the system to ensure that there's good hand hygiene in communities. And then we're going to spotlight some of the other sessions that are addressing hand hygiene at the conference here. So it's going to be a great session, and we will have a time for Q&A from the audience after the panel. So do think about what questions you would have and be ready to come up to the microphones here. And with that, I'm going to introduce Na Nguyen, who is our USAID representative on our steering committee for the Global Handwashing Partnership. A great mind in the area of behavior change in different areas, but certainly around hand hygiene and hand washing, and we have great discussions as part of our partnership. So Na, please take it away.
Thanks, Ron. Okay, first observation is this setup is not made for short girls. So I'm gonna have to do this TED Talk style. I'm hoping that I remember all my speaking points because my notes are there. But as Ron said, the Global Hand Washing Initiative has been around for a long, long time, right? And when I started with promoting hand washing in 2005, it was clearly a wash behavior, right? And it was a wash behavior before we even had wash, because it was called Watsan. Remember that? There was no hygiene even, right? So hand washing was for wash people. And we promoted it in schools and communities. But fast forward now, we actually see that hand hygiene, not just hand washing with soap, but also hand hygiene with alcohol-based sanitizer, is critical to so many health areas, right? So Bruce mentioned yesterday antimicrobial resistance. He mentioned infection prevention control in wash and healthcare facilities, right? Hand washing is essential to saving lives of mothers and babies, and is essential to the nutrition of young children. And yet, why is it so hard? You know, we've been at it for a long time. I've been thinking about this my whole career, right? And I think one of the challenges of hand washing is a bit easier to understand when we think about the typology or the characteristics of the behavior, right? So sort of three main things that I think about that makes it really hard. One is frequency, frequency, frequency. How many times do we have to do it in a day, right? To perfect our hand washing, to do it consistently. So within wash, we have post-defecation, post-contact with child's feces, before preparing a food, before feeding your children. But then when you look at hand washing in healthcare facilities, I was just looking up the CDC guidelines for infection prevention control, and there are so many times that a healthcare provider must hand wash with soap or practice hand hygiene, right, with alcohol-based sanitizer. So it really is no wonder why the WHO says that hand washing rates in hospitals and medical facilities in developed countries is never higher than 70%, right? So it is a bit understandable why it is so challenging. I think another thing that makes it challenging is that it's not a rational behavior. It's a habitual behavior, right? It's something that you can do while you're practicing your speech for a session like this, right? It requires more muscle memory than actual first I do this and second I do this, except for healthcare providers. So it's a habitual behavior. It's automated, right? And so it requires more of muscle memory. It requires a stable context where you have water, you have soap at the right place, but then you also have a cue. I mean, what is the cue, right? So if we think about our facilities here, after you use the toilet at UNC, your cue is the sink. So at least you have something that says you should practice hand washing after using the toilet. But in the absence of facilities, water and soap, and in the absence of cues, it makes it really particularly hard for the communities that we work with, the healthcare providers that we work with, to practice the behavior. And then just going back a little bit about the frequency, right? So as we learn more about the science and the role of hand washing, we're actually including behaviors such as post-contact with animal feces, right, or animals. So again, if we think about automation, right, turning it into an automatic behavior, the more junctures we have, the more environments we have to build for hand washing to occur. We have to build queues in healthcare facilities. We have to build queues in other parts of the house beyond the toilet. And the last one is social norms, right? There really isn't a norm anywhere in the world for hand washing, right? It's just not necessarily an essential habit or behavior in any culture that we've sort of ever studied. And so, creating that norm is one of the challenges to hand washing. So I was noticing while we've been here that, how they have these lovely snacks and water and everything when we go out there. And after you finish, it's like, well, where do you put your dirty dishes? And what I've noticed is that really most people don't put it back at the table, right? They look for a smaller table, the round tables to put there. That's a norm, right? So if you're visiting the US for the first time, but you see that cue that, oh, nobody's putting their dirty dishes here, that means, I will not be socially acceptable if I do that, right? So creating norms is also a very challenging but necessary action for hand washing. But it's not all doom and gloom. We're actually here to talk about the opportunities to make hand washing easier for our governments, for our implementing partners, and perhaps ourselves. So I think with that, I am going to turn it over for a video from Joanne Estevez-Mill from the WHO, the World Health Organization, and she is going to give us a preview of the upcoming global hand washing guidelines in communities. Yeah, so with that, take it away, Joe, virtually.
Hi UNC, I hope you're having a great conference so far. I'm sorry not to be with you in person, but thanks to Global Handwashing Partnership for facilitating this recorded presentation. I did try and record this with video at one point, but I saw that it was blocking the content on the slides, so please bear with me. I've been asked to provide a brief overview of what's in the upcoming WHO guidelines on hand hygiene in community settings in 10 minutes. And I know that later in the session, the panelists will be asked how they see these guidelines influencing their work and thoughts on how implementation might be promoted at the national and local level. So I look forward to connecting back with the Global Handwashing Partnership to hear how those discussions went. And before I start, I do want to say that this presentation will not cover the specific recommendations or guidance that the guidelines will provide. And this is because we're still in the process of developing that guidance, and this won't be published until Q2 of 2025. But what I can do during the next 10 minutes is provide an overview of the content, which I hope will be enough. Before going into that content, I do want to flag that these guidelines are being developed through a rigorous process published by WHO in the Handbook for Guideline Development that's linked to at the top right of this screen. Providing guidance on norms and standards is a key function of the WHO, and each of its guidelines must follow this rigorous process that's outlined on this slide. And due to lack of time, I won't go into the specific steps, but I do want to note that it involves an in-depth assessment of the published evidence on our topic, as well as extensive consultation and engagement at different stages with a number of contributor groups, including academics, end users, and beneficiaries. In terms of the recommendations on norms and standards, which we'll look at in just a moment, that involves assessment of the evidence through a series of systematic reviews that we've commissioned, and I've linked to the protocol at the bottom there, and then deliberation discussion by a group of experts that's specially curated for this process. They're the guideline development group, and they comprise academics, end users, and beneficiary representatives, and they are the people currently working with us to formulate the recommendations, which will be published next year. I've also pasted a few of the published papers that sort of chart the process that we've been through for these guidelines on hand hygiene in community settings at the bottom there for anyone who wants to take a look later on. So this slide really provides an overview of the guidelines, and we'll go into some of this a bit more in detail in the following slides. But on the left, just to flag that when we're talking about community settings, really the easiest, quickest way to define community settings is by what they're not. So it's really anywhere that's not specifically focused on delivering healthcare. So we have, WHO has very well established guidelines, global guidelines on hand hygiene in healthcare facilities, and has done for several years. Really what we're trying to do with the upcoming guidelines is to address a gap that was felt especially acutely during the COVID-19 pandemic, this gap on guidance for hand hygiene in community settings. And here we're defining them as the household or public spaces or institutional settings. And you can see that on the left. In the middle of the slide, a very brief outline of a pared back theory of change that underpins the guidelines. So really to start at the top with our goal that is effective, sustained hand hygiene, and looking one tier down, identifying that we need to have there are certain minimum material requirements to enable the practice of effective hand hygiene. And on the right, for that practice to be sustained, there is a behaviour change element as well. And the tier below that acknowledges that in order for products and services to be in place in a sustained way for delivery of minimum requirements and behaviour change, there needs to be a strong system in place. And the final block at the bottom in green acknowledges that strong systems do require work, do require understanding where the gaps are, and strengthening systems through effective plans and planning. And based on that theory of change, the global guidelines have three main buckets of content, and we'll look first at this purple bucket, so recommendations on norms and standards for hand hygiene in community settings. Now, the first thing we want to do in the guidelines is to define effective hand hygiene. We know that effective hand hygiene is hand hygiene that enables the removal or deactivation of pathogens from hands. What we want to provide guidance on, and where we saw there was discordance in existing guidance, is with what products should effective hand hygiene be practiced, how, so in terms of the technique, for how long, and when, at what key moments. But also providing guidance on those preconditions that we looked at in the theory of change model. So we know that preconditions for effective hand hygiene are water and soap, and we should really include here alternatives such as alcohol-based hand rub, but also knowledge, so knowledge about when and how and why to practice hand hygiene, and finally motivation, so we do need that motivation to sustain the practice over time. And these are the things that the guidelines will touch on and will provide parameters and guidance on. In terms of the second bucket of content that the global guidelines look at, it's guidance on system strengthening for sustained implementation of these recommendations on norms and standards. And here, so if we go back to our initial model looking at the aim of sustained practice of effective hand hygiene by all across community settings, and we have our preconditions listed at the top there, what we want to answer in this chapter on implementation is what needs to happen to make sure that these preconditions are in place. What functions need to be performed in a system? what is upstream of these preconditions? And here we're talking about service functions, so what services are required to deliver the preconditions. And we're also talking about governance functions. What functions can support the effective delivery of these services? And finally, we really want to look at who needs to do what and which of these functions is performed by which actors or which actor categories. What are the roles and responsibilities of actors in this space, and providing guidance on that. As we know, specifically for hand hygiene, it often falls through the cracks because it's cross-cutting. So just a quick note on this implementation guidance. We've been working with a number of different groups. We're co-badging with UNICEF, the largest implementing agency for hand hygiene programs. Globally, we've developed a group of champion countries and comprised of 10 countries across 5 WHO regions and 4 global partners as well, including UNICEF. And you can see here that we've published a paper that sort of provides the basic principles for development of this guidance that you can have a look at in your own time, and some photos here of some of the workshops that we've been carrying out throughout this process that's briefly sort of documented here. We drafted an initial framework for understanding a hand hygiene system, so a simplified system for delivering hand hygiene services and products. We tested this framework with our champion country working groups through a series of national workshops. We improved and iterated based on the data that we received through those national workshops, and we presented that back and validated it further through a global workshop that took place in June this year in Nepal. And we're still in the process of reviewing the feedback received through that global workshop and improving the framework further, but I did want to share the current iteration of the framework that we have. And you can see here those service functions here that we talked about, and the governance functions here that we talked about, as well as a series of other factors that we don't have influence on, but that do inform what's possible and how to implement in a specific setting. On the left-hand side, we have our categories of actors from the national authority all the way down to the setting administration, or if in the case of a household, the household head. And what we want to do in the guidelines, and we've been collecting data on through our champion country workshops, is to provide specific guidance on the different roles and responsibilities of these different actors when it comes to this system depicted here. Moving to the third and final bucket of content in the global guidelines. And this really emerged from specific demand that we heard in our kick-off workshop with our end users in May of last year, in 2023, in the IRC All Systems Connect conference in The Hague. We held a workshop with 50 government representatives and partners and consulted them on the guidelines in development. And one of the things that they requested specifically was that we should go beyond just providing guidance on implementation and this implementation framework that we're developing, to providing step-by-step guidance to government leads on how to develop and implement and monitor a system strengthening plan. And this is what we're working on. We're taking an existing step-by-step process that WHO utilises in guidelines as our starting point. So these 5 basic steps: prepare for action, analyse the situation, so do your baseline, understand what the issues are, develop an action plan to address those issues, execute that plan, and then monitor, evaluate and course correct on an ongoing basis. This has been the subject of some consultation through our champion country working group, and we've received some feedback around the need potentially to align better with existing steps in the WASH sector, and in particular in WHO guidance, whether it's the sanitation and health guidelines and the UNICEF game plan and the new roadmap that's been developed there, or the WASH in healthcare facilities, practical steps. And so we're reviewing that and should have something for publication by next year. I hope that was useful to the discussions that are coming up. If you have any questions or comments or suggestions, please contact me. My email is on the slide. If you want to stay tuned on the process, then do sign up to the WHO WASH Unit newsletter through the link provided here. Thank you. Thanks so much for your attention, and back to you in the room.
First applause, even though she's not here. Okay, can you hear me? Yeah, okay, great. Well, I have to say, I realized, this is probably my 7th time seeing that presentation. And of course, because it's WHO, it has to be very comprehensive and somewhat complex. And it probably will be a heavy document. But I have to say, as one of the reviewers, I do think that it does cover a lot of the questions that we often get in hand washing programs. Water quality, water quantity, soap, availability of soap, cleaning agents, behavior change, what has been effective at changing behavior. So although we're not able to actually talk about the guidelines in detail, I do think that once they come out, it will be actually a very useful document. So next up, we are going to have a panel discussion about the guidelines and hand hygiene more generally. So we actually have 3 in-person colleagues here in the room with us and 1 online. So John, are you able to hear us?
I can hear you now.
Perfect. Okay, so I am going to read you a brief bio of John, and I would like to invite the 2 other panelists to come on up. 3, right? Okay, so John, hi John. John is the Global Director of Research Development and Evaluation at SC Johnson Professional, where he leads the research development and engineering globally for the company. He holds a PhD in chemistry from Oxford University, and he has over 30 years of experience in industrial and consumer product development. Okay, so starting from the end there, we have Dr. Christine George. She is a professor at Johns Hopkins University. She is an infectious disease epidemiologist and environmental engineer with 17 years of experience conducting WASH studies internationally, including directing 9 randomized control trials of community and healthcare facility-based WASH interventions, and an old friend of the GHP. All right, in the middle is someone I think everybody has seen and knows. So Chiseko Sedano is a WASH specialist at UNICEF. And she has over 16 years of experience in the UK and Zambia. She's led a lot of key projects, co-developed multi-million-dollar proposals, and coordinated humanitarian responses. And you will see her because she's also a staff member of the conference, so she's been wearing many, many hats. And finally, Maureen Kasande. Kasande is, she works at the Infectious Diseases Institute at Makerere University in Uganda, where she is a technical advisor for a CDC-funded WASH project whose goal is to increase access to and utilization of alcohol-based hand sanitizer in 6 districts in Uganda. All right, welcome. Okay, so I've got a couple of questions, and maybe we will start in the room. Chiseko, so throughout the week, we've heard updates around the WHO UNICEF guidelines for hand hygiene in community settings. And in Joanna's presentation, she shared some broad areas what the guidelines will cover. For you, how do you think these guidelines will influence your delegations?
Okay, thank you, Na, for that question. So one of the things that, how those guidelines would definitely influence our delegation is in how we work with the government. So we work very closely with the government. We work through existing structures that already exist, that are already there, national level, provincial level, district level. But in terms of how we engage, they give us a tool that we can talk about. One of the things that we did in one of the workshops at the start of last year with the government was to go through the hand hygiene acceleration framework tool, and it basically helped us to establish status. So where are we with hand hygiene? So questions around the enabling environment, for example, policy, do we have a policy on hand hygiene? Yes, no. Do we have, resources, financial resources allocated to hand hygiene? Yes, no. And we basically went through this process. So one of the things, this guideline that's coming out will help us to even just cross-check, and where there were a lot of reds, because we found there were a lot of reds, as in we need to do better, we can use the guidelines to help us to improve. Another thing that we can think about is also, as actors supporting the government, how can we better collaborate? We've got a CP group where all the development partners are a part of, but how can we better support the government together? I think we heard about that this morning from Dr. Mary about development partners getting together and supporting the government. So that's another way in which we could use the guidelines to steer. We could put that as an agenda item on one of the conversations on the regular cooperating partner group meetings. Another thing that we can think about also is further engagement with the private sector. So when we have conversations around supply and demand for hand hygiene, who are the actors in there? What can we do? I think this is something that we can think about at a higher level, yes, but then how does it trickle down to the ground so that we actually have hand hygiene being practiced on the ground? Thank you.
Super. John, did you hear the mention of private sector?
I did.
All right, great. Well, what about you? How do you see these guidelines influencing your work in the private sector?
Yeah, I hope you guys can hear me okay. I'm really sorry I wasn't able to make it in person, but happy Global Handwashing Day to everybody. It's a great question, and I think I would say, first of all, that they'll be incredibly important for us, and in two really clear ways. The first is product design. So we're obviously very, very keen to design products that really work for our customers and our users, and having clear guidelines to indicate how best to design those products to fit, to be part of that behavior change and part of that integration in facilities is going to be really important for us, as it is in healthcare. And then secondly, we're very often asked by our customers for advice on where to place hand hygiene and how to use hand hygiene in their facilities. And this could be schools, it could be workplaces, public facilities, many of the community settings that Joe mentioned. And we always try to provide the best advice, but in the absence of a clear set of guidelines from a recognized authority like WHO, sometimes that's hard. Often our customers have many stakeholders and many sometimes competing needs. And so in the absence of a clear unified set of guidelines, it can create confusion. So having that clear guideline, being able to assert best practice with authority is going to be really, really important for us. It will help us provide the very best advice and support our customers and users to practice hand hygiene and to implement behavior change at their facilities.
Super. So as part of the guideline development, there was a massive desk review by Emory University to gather all the data amongst all the different types of recommendations and topic areas. So it's a huge evidence base that sort of is driving the guidelines. So regarding evidence, Christine, could you tell us, can you talk a little bit about the importance of having validated research in developing the recommendations?
Yes, so it's absolutely fundamental in terms of deciding which type of evidence-based intervention should be implemented. And the guidelines, I think, will also provide important insights on the interventions we should focus on, and then the next step would be how to contextualize those. And so we know in different settings, the interventions need to be implemented differently based on the cultural practices and the norms in the setting. And so these guidelines will really be a good place to see where the evidence gaps are, to build evidence in those areas, and then to be able to test them in different contexts globally.
Super. So, John, do you see the evidence in this in the global guidelines? Do you see that having an impact on your work in the private sector?
Yeah, absolutely. I mean, again, my role is research and development, so again, back to product development in the first instance, we obviously try to implement or try to utilize validated research as much as we can when designing products, when validating and evaluating our products. And so having that research-based approach is really important for us at that level. And then if I come back to my other earlier point, when it comes to giving advice, we're in the professional business. As I said earlier, we're working with schools, with workplaces. We work a lot with hospitals, with facilities like food factories or food service facilities. So in lots of these facilities, the people we're talking to and the people we're advising are themselves professionals, are themselves often very technical researchers themselves. And so they don't want to take advice that isn't supported by research. They don't want to make decisions on behalf of a school or a hospital or an airport, for example, that may not be fully robust. And so us being able to indicate that research and being able to support our advice with the research that supports it, with the authority that comes from WHO and UNICEF and all of the partners that have gone into developing these guidelines, again, is really important. It helps create trust. It helps create confidence. And I think it's going to be, incredibly valuable in getting people over the line to actually implement behavior change and implement the guidelines in their facilities. So again, I think these are all critical parts of setting the foundations, as Jo said in her presentation, towards a robust and successful implementation.
Okay, super. So Maureen, this morning, well, just before the session, the plenary session was really focused on turning guidance into policy and policy into implementation. So what strategies should be employed to ensure that these guidelines are effectively communicated and adopted at the community level?
Yeah, thank you. Thank you for that question. And I want to say this is a very exciting and important guideline that we have for communities. After a lot of being done in healthcare facilities. Yeah, so one of the recommendations I have is the timing within which these guidelines are launched. Because for the most part, we must remember that we are dealing with communities, and communities will respond according to the events around them. For the most part, hand washing is talked about just during an epidemic, or during a health threat, or there's a cholera outbreak, there is an Ebola outbreak, or there is some sort of outbreak that's going on, and then we choose to release guidelines at that point in time. So the communities are most likely to synchronize the guidelines with the events, and know that once the outbreak is declared closed, or there are no outbreaks, then it's back to business. Just like we saw with masks. We saw that with COVID, and right now nobody cares about that. It was very hard to get people to start wearing masks, and right after the COVID-19, of course, we still have some cases, but I mean, we had lots of peaks. So we want to be very careful at what point we launch the guidelines in community settings. The health workers have been interfacing hand hygiene for a very long time. They know, or they probably understand, but we still have challenges there. I would say that the numbers, if you do a hand hygiene audit among health workers, you still see that there are suboptimal scores. But now think about the communities. Will we only talk about hand hygiene only when we have disease outbreaks? Or are we going to go out to them and try as much as possible to appeal to their cognitive function to understand and receive hand washing as a normal notion? Yeah, I think that would be my biggest recommendation. Thank you.
Yeah, I think that message was also quite consistent. If any of you went to the session this morning on the release of the technical guidance for hand washing facilities and public spaces, I think one of the thinking that has evolved is that we can't really think, it's hand washing all the time. It's not only just in outbreaks, right? It's not only just for healthcare settings and schools, it's all the time. And I think that thinking about hand washing practice actually increases a community's resilience and ability to deal with outbreaks. Because if people are already hand washing, right, it will become much more intuitive. And I was also, the diagram that was up earlier was related to some research that they had done on, some behavioral economists had done on hand washing during COVID. And one of the things that they think contributed to the reduction of hand washing practice is the use of masks. Not just that we focused on that behavior and not on hand washing, but that people felt because it was respiratory and because they had a mask, they didn't actually need to hand wash, right? And so in a way, the mask actually was the most protective behavior. And so, hey, if I have a mask, I don't necessarily need to hand wash as much. So what about you, Taseko? What strategies do you think should be employed in these guidelines to be effectively communicated and adopted at the community?
Thanks, Na. So strategies to be adopted, one of the things, so just making it a bit more practical in our case and just sharing the Zambia case, we are in the process of developing a hand hygiene for all roadmap at national level. And I think that so the idea is that this is a costed roadmap. So then the resourcing question, hopefully in a way, at least in terms of the planning, gets answered, because then we have a document which guides the country in the different settings. So basically, we identify what settings will this roadmap cover. So, public spaces, communities, institutions. And then also, so aside from the settings, it's also like what exactly are we going to do, and who is responsible for what. So I think that came up on one of the slides in terms of roles and responsibilities. And it was interesting because it doesn't necessarily sit within one ministry, because we have Ministry of Health for the Public Health Act. We have the Ministry of Water that has a mandate for water supply, sanitation, and hygiene. We have the Ministry of Local Government, which is where we will have, Ministry of Local Government and Rural Development. So all the traditional leaders who would be on the ground, supporting, they would be covered in there, even the Decentralization Act. Then Ministry of Education with the schools. So you've got all these actors identified in terms of leaders, but then it's like who really is in charge. So we had to form a steering committee of all of these together so that in the development process already, it's co-development together with the actors, the other sector actors that are involved. So the actors involved, who's responsible for what are the settings, and then identifying, what are those activities that we need to be doing. Whether it's infrastructure or behaviors, just identifying the actual things. We had a theory of change that was developed. It looked a little bit, some of the points that were raised, like on the screen, are a bit similar, because it will be things around governance, capacity development, and so on. So those were all identified. So we have a draft document, and we're at the stage where the costing is being done, because it's also like when we look at where are we with hand washing, basic hand washing for the country, almost 29%. Where do we want to get to? How many facilities, for example, will we need to get there? So it gets very nitty gritty on the how to, because the guidelines are all up here, but in practice, in terms of the strategies, everybody who needs to be a part needs to be involved to get their voice to the table, if we're actually going to get the hand washing facilities to people on the ground, and to get everybody to understand and get on board to be together in that process. So yeah, it's a long and drawn out process. This is just the development of a document. We haven't even really said, like, okay, now start with implementation. So I think that's one way that in our case is a very practical step to answer some of those reds, when we establish status for where we actually stand in relation to hand hygiene. Thank you.
Sorry, just a follow-up question since I'm facilitating and I have the privilege of asking. So when you think about the costing for the roadmap, where do you sense the majority of funds are going to come from? Or is it a deliberate that these will come from national budgets?
I think it would be a mix. So we're not there yet, but I think it's a mix. And I say this because looking at the rest of, so not just, for hand hygiene, when we look at sanitation, when we look at other parts of the sector broadly, the funding comes from different sources. So we will have development partners supporting even the household themselves have to pay for things. So I think the sources will be different. The government will have an allocation as well, but I guess allocation is one thing, and then actually providing the finance is another thing. So at least it will be there in the plan with the sources identified, and then in practice we will have to see, what actually flows. But yeah, but it's also like it's scattered in different places. So you have sanitation and hygiene is over here. Yeah, so I guess it's also bringing together all of this from the different places where budget lines are allocated for hand hygiene.
Okay,
Thank
super.
you.
Okay, so I have one last question because we actually have other parts of this session to cover. So my last question is for all the speakers, yeah? So let's beyond the guidelines, right? So let's just forget the guidelines for a second. Let's talk about the small h, right? The H in wash, which is often we feel like the small h, not a capital H, right? So in your opinion, how can we continue to elevate hand hygiene, yeah, so that the little h is more like a big H and gets as much attention as the W and the S? So maybe, John, maybe we can start with you.
Sure. Yeah, I think it's a really important question, and I love the way it was posed earlier in the session by Ron. If you don't mind, though, I just want to first lend my support to the answers that were given on the previous question. I think that the two key elements that were drawn out there around making sure that we communicate hand hygiene guidelines for the everyday rather than just the outbreak. I think that's so important, not just for behavior change, which is really important, but also from our perspective in the private sector to make sure that supply chains are in place and operating when an outbreak happens. I think it's really important that we're hand washing every day. And I think the other thing I heard very clearly was again the need for public-private coalitions to make sure that we're operating at all levels. So I just wanted to say that, if you don't mind. Regarding this question, I think it's a great question. I think from my perspective, I would say, and again, with no disrespect intended to the W or the S, but I would argue that the H in WASH is the most global and the most globally relevant of the three. And what I mean by that is that regardless of where you are in the world, whether you're in North Carolina as you guys are, whether you're in the UK as I am, whether you're in Uganda or Zambia or where some of my panel colleagues are from, hygiene is always important. It's always important in settings like schools, like workplaces, and it plays out in very much the same ways. And so I think, therefore, the H in WASH is in that sense something for everybody. It's something that every government should be taking seriously. It's something that every facility should be taking seriously. It's something that none of us have adequately achieved. As long as we have workplace absence during flu season, as long as kids are missing out on lessons due to respiratory infections or diarrheal infections, we haven't achieved WASH. I think we've heard statistics today around 25% or 40% or 70%, depending on the settings that we're talking about. But nowhere in the world have we achieved it. So I think for that reason, it's if you like, it's the thing that binds us all together, and it's the thing that we all have to aspire to get better at. And then I think, the role that we can play, because I think part of your question is how can we all ensure we're integrating it. I think the message that we can play in the private sector is bringing that story to our customers and our users where they work, again, whether that's in schools, airports, offices, facilities, whatever it is, just to make sure that we bring that message to bear and make sure that wherever we operate, we're helping people implement best practice, that we're helping people reduce the incidence of infections that take place in their facilities, keeping people in work, keeping kids in school, keeping people traveling and getting where they want to get to. And so I think, that's the key role we can play. And just to make sure that we continue to advocate for hygiene. I think Ron said it very well earlier. It's probably the simplest and easiest preventative to many, many diseases. So that's essentially what I think.
Super. Thank you, John. Anyone else in the room who would like to go first? Christine?
And so I completely agree with the points that John gave. And I think also from a research perspective, we saw that there were these large-scale community-based wash programs that didn't see the uptake in the hand washing with soap that we necessarily expected, or the health impacts in terms of diarrheal disease and child growth. And that's really indicated the need for transformative wash, approaches that are novel, that are increasing hygiene behaviors within the community. And I just wanted to highlight some of the recent evidence that we've gained from our work both in Bangladesh and in the Democratic Republic of the Congo, where we delivered weekly mobile health messages on hygiene behaviors that were given by a doctor at a local diarrhea treatment center. And we found in our randomized control trials of these interventions in two very distinct contexts, Bangladesh and DRC again, that the intervention was effective in terms of reducing diarrheal disease and also reducing stunting for children under 5 years of age. And so it really showed that we need novel approaches to be able to implement community-based wash to really promote hygiene behaviors in the community. So it's just an approach that I would like to promote among all of our hygiene practitioners in the room to consider integrating mobile health as a form of transformative wash into your hygiene activities.
Thank you so much. So elevating the little age. So just picking up on, John already talked about, the engagement with private sector, and Christine has mentioned research. What I was thinking, just building on that, it's basically like we all have a role to play. So these are just two areas, in terms of like the actors or the spaces in which we could engage. But if, for example, somebody in here is a policymaker and they're reviewing a policy, they should be looking for where's the hand hygiene in this, or if we're working with a community, we should be thinking about how are we engaging with this community differently, because we know what we now know about hand washing and hand hygiene. So I think that it's something which it would take a long time. I think Christine just talked about the longer term. It would take time to see the impact, but we have to stick with it to get that impact. So that's something that that I would say. Thank you.
Hand washing grit.
Yeah, for sure.
Yeah, thank you. I think I'll go back to what WHO did to make sure hand hygiene within health facilities works. I keep referring to the health facilities because a lot of work has been done there, and now we want to do the same for communities. So the WHO developed what we call multimodal strategies. So the 5 multimodal strategies talk about the culture change, system change, reminders in the workplace, monitoring and evaluation, and feedback, and then training and education, things like that. So do we want to look at this model and see how that can help within community settings? Because when they talk about reminders in the workplace, they mean IEC materials and other sorts of reminders that can help health workers to remember to wash their hands. So what are those things? What can we borrow from this model? And has it worked anyway in the first place? Can we interrogate that model and see how it has worked in the health settings and see how we can tweak it to work for us in community settings, so that now our H is, it's coming out stronger, not only for, and I'll say the H in terms of hand hygiene because it's Global Hand Hygiene Day. Yeah, so trying to see the models that have applied, that have worked, and then we see how to work them out within community settings, knowing how dynamic the community is, how unstructured sometimes the community is, and how to work with the stakeholders within the community to advise us. We talk to them and begin to borrow some of the strategies, some of the innovations that they have themselves for hand hygiene, and try to incorporate them into these models. Yeah, that would be it for me. Thank you.
Super. So I guess maybe I'll just have one last point as what can we do? And I think about hand hygiene all the time, and I think, gosh, it's always the underdog, right? It's like everybody rushes to the water section, the sanitation sessions, and hygiene's always the underdog. But that's why we need to keep working on it, right? Because if you drop the underdog, if we stop advocating for it, who is actually going to advocate for it? And the science is clear that hand washing is like the do-it-yourself vaccine, right? So I think sometimes I feel discouraged, but I'm like, no, we've got to just keep going. We've got to have the grit. We've got to keep advocating, because if we don't, and we don't fund it, and we don't continue to focus on it, then no one else will, right? And I think the health sector has many of their own challenges, and so they're not necessarily going to necessarily prioritize hand hygiene, so we've got to advocate and find ways to also elevate it through the various health areas. So with that, I think, where's Ron? Oh, there you are.
Great panel, great insight. You see the different elements of the hand hygiene system, and that's what it takes. It takes all of us. This is a time that we have for Q&A now. So we have a microphone on each side of the room. So just come to the microphones with your questions, comments, your Global Handwashing Day stories, but please just come to the microphones. Don't be shy. Go ahead and introduce yourself, tell which organization you are, and please ask your question. And if you have a particular panelist that you would like to answer the question, then please let them know.
Okay, thank you. My name is Joel Ochieng. I work for Population Services International, mostly on the big S, that is sanitation, and not so much focused on the small h. But thank you very much to the panelists. It's been great to update myself on all this information. My question was just, what is the time frame for the development of the guidelines? I know that there's still a process to go, but I'd like to know where are we along that timeline towards the introduction of the guidelines. Thank you.
I didn't quite hear all of that. Joel, can you just again, where are we in the longer term? I didn't quite.
In the time.
Oh, where are we in the timeline? Oh.
So the guidelines are planned to be published in the second quarter of the calendar year, next calendar year, in 2025. This has been a long process. I mean, we've been working on this, it seems like for years, which it has been for years, but it's a big challenge, and there's great care taken with developing WHO and UNICEF guidelines. And we're very happy with what we see developing, and certainly with the Global Handwashing Partnership, we've been very happy with how we've been involved in helping to facilitate stakeholders to have a voice in it. So thank you for your question. Okay, any other questions? Or again, favorite stories from Global Handwashing Day?
Hi, is that working? Okay.
Yeah.
Hi, I'm Victoria Trinice from the US CDC. And I was really struck, Charity, that was written up there, but I know that's not the name you go by, sorry, by what you were saying about the funding for hand hygiene work coming from a bunch of different sectors, because hand hygiene is cross-cutting. It is definitely, you need it in school, you need it in health, you need it in communities and everything. I'm curious, especially for those of you working in countries where these are really going to be pushed forwards, just because everybody, but do you see the need for a particular champion? Because I feel like when we have everybody responsible for something, then it sometimes falls to the wayside. So how do we kind of rectify both the need for a champion and the need for it to be cross-cutting? And how do you see that going forward in the countries that you have experience with?
Thank you. It is a good point, and yeah, I think that it is a challenge which we will have to work through. So at the moment, the champions seem to be, so at least at national level, At the moment, the champions seem to be Ministry of Water Development because they have the mandate, and then they're working closely with Ministry of Health. So we've had to have like co-leads of the steering committee, and then they would be the ones to lead. But when you go down to the community level, so for example, you will have the traditional leaders. In the rural setup, you will have traditional leaders. So then there, the chief, is in charge. So for sanitation, we had sanitation champions. Some of you might have heard of Chief Macha for the CLTS, so then he's a champion, and then he influences other chiefs for other chiefdoms fighting for open defecation. In that sense, I think it sort of worked. But the question is, for hand hygiene, who would that be? So if, for example, we had a chief, because they're very influential, if we had a chief, a champion chief, I think that could work, because if they manage to showcase within their community, this is how we've done it, other people can come from other parts of the country to visit us to see how we've done it, maybe that could work. But the question is, who are those like early, who will take it up first? Who would want to be the champion, So I think those are still open questions. I think it has been demonstrated that if you have a champion, they can have quite a big influence on others as well. So in that sense, I think it's a good idea. And maybe that's something that we need to think about more. Yeah, thank you.
Okay, great question, and very important answer there. Again, to point out the multiple levels of the system and how many different levels of that is required to have an impact. Go ahead with your question, please.
Yes, thank you. My name is Bruce Wumhunda from Water for People Rwanda, but currently working as Deputy Chief of Party for a USAID project. And we're working on water, sanitation, and hygiene through a system strengthening approach. So I have a question, but also a reflection to share. First, I would like to thank the presenters and the panelists. Thank you for your good thoughts and sharing, and also wishing you a happy Global Handwashing Day to everyone. What I wanted to share is what we are doing as a system strengthening approach to make sure that the guidelines, the strategies are communicated from the partners to the communities. So we work with the government, the same like other partners, but what we are doing is that all the good strategies, all the good strategic document that we produce are kept at a database that is hosted at the national government institutions, so that we have a national compass, which is like a platform where all the materials, all the hand washing materials, guideline messages are first validated through a thematic working group, but are stored into a database so that anyone can access them and can be disseminated. So my question now is to the first presenter on the functions. There was a function on knowledge and motivation. I couldn't draw the demarcation between the two. Where does the knowledge start and where does the motivation start? Because for me, I even saw behavior change. I couldn't say, is it part of the knowledge or is it part of the motivations? So I was like, where do I locate this and where do I apply knowledge and where do I apply motivations? And I really missed the examples of the motivations, because for me, behavior change might not really be a motivation, rather might be a way to achieve the knowledge or to apply the knowledge. So that's my question to the first presenter. Thank you.
Well, I think the first presenter then is Jo.
Yes.
And she's not able to join because it's very late there. So maybe I can take a stab at the question.
Please
I
do.
think I think that knowledge is, you need to know actually when to wash your hands and when you have a new juncture. For example, with COVID. When COVID hit, you had all these new junctures, like after coming home, right? You're supposed to wash all your hands. Or so when we have many new different junctures, there are new behaviors. So I think that people do need to know what those are and their role in preventing whatever illness it is that we're trying to address. I think motivation is also really important, right? And I think that it does follow knowledge, but I think that hand washing is about habits. And so the challenge is to move from motivation to automation, right? So you shouldn't, you might, want to wash your hands because they feel gross or they feel sticky, but really, you should just wash your hands because there's a cue there, and there's water, and there's soap, right? And so you shouldn't have to say, oh, the WHO guidelines said that I should wash my hands now. No, it's like, I want to feel good. I see a sink. I should wash my hands. I'm going to eat, or I've used the restroom. So I think that is the biggest challenge, is turning it into an automatic behavior versus something that you think about and something that you want to do all the time. Because you can do things without actually wanting to do it. Seatbelts, right? You get in, it's a cue. I just do it automatically, and I don't think, oh, it's going to save my life. I just do it without thinking about it. And I think that's where we want to be. That's where we want to be pushing hand washing behavior change approaches.
That's a great answer, and I'm glad you brought up that, again, you brought up the question of hand washing really has to be a habit, because it's not like having your children vaccinated where, well, this happens every year or something. This is something that has to happen multiple times every day. So we can't be thinking, oh, well, now's the time I need to do hand washing. It just needs to be our habit. Please go ahead with your question.
Yes. Well, it's a comment that I have. I am Saidu Kanu. I work for World Hope International. We do wash in West Africa, Sierra Leone, and Liberia. I'm really happy about the emphasis on hand washing. If you look at the three elements, clean water, sanitation, and hygiene, hygiene is the cheapest part of the three elements. And sometimes, probably in our culture, anything that is cheap is not valued. So there is much work to be done in terms of promoting hygiene or hand washing. Very simple, it has to be a habit. But I'm here this afternoon more to advocate for things I'm seeing, I'm experiencing. We all talk about hand washing, make sure you wash your hands before eating. I have observed that when you are flying, when you are doing international flights, when they bring the food to you, they give you something to wash your hands or to wipe your hands. But for internal flights, they never do. They bring the food, they give it to you, then they expect you to eat the food. So I'm appealing to the global hand washing team to advocate to the airlines to make sure that before they serve food on those planes, they provide something for people to clean their hands.
Thank you. Thank you for those comments. Would anybody like to respond to that? I thought that was very insightful. I mean, what I think it points out is that there's numerous different barriers for hand washing. So even though it's a simple behavior, it's also difficult, and it's difficult for everybody. We'll have one more question.
Thank you. My name is Makwant from USAID Ethiopia. I think I want to share my experience with Ethiopia's experience. I think this hand washing guideline, in order to implement this guideline, I think Ethiopia has very strong institution such as we have health extension workers for every 5,000 population on average. This is the lowest administration unit. We have 2 female health extension workers promoting hygiene and sanitation along with other packages, house to house. I think this is, a strong environment in terms of knowledge. We are good, however, still the practice is low. Probably my question is, what is the next step? This guideline need all countries to adopt directly apply this guideline or develop their own contextualized guideline? Thank you.
Oh, yeah. So I would say some of the recommendations in the guideline are quite straightforward, right? And can be applied across. I think a lot of the guidelines is really clarification of questions that we always ask related to hand washing. I think it's probably going to tend to be less on the you must do this or you must do this. I think the analysis, for example, of behavior change, right? They're just going to offer up promising behavior change approaches, but of course, as you know, that needs to be contextualized to each of the countries, right? So even when you have a behavior change, like even when you have an intervention that works really well in the DRC, you're going to have to go and contextualize it for Ethiopia. So I think the guidelines will not be as directive as you think, but it will provide suggestions and evidence, and then it is up to the policymakers and the program implementers to take that and then design their own programs and contextualize it.
And I would just add to that, I think the guidelines will be useful for every country and serve as a catalyst for every country to cross this hurdle for better hand hygiene. You know, we've had great comments from the audience and we've had great comments from our panel. I'd say let's just give applause to everybody. And at this point, I'd like to introduce a colleague, Julia Rosenbaum. Oops. Is from FHI 360, has been part of the Global Handwashing Partnership for years. At this point in the session, we're going to spotlight other sessions at the conference that are about hand hygiene. And I think Julia has a interesting twist to that. Julia?
I'll try to deliver. Thanks. It's great to be here. Oops, I need a mic somewhere. I think that's on, yes? Thanks. Perfect. Great to be here. I love this meeting. It's probably my 10th UNC meeting, and it's great for the scientific sessions. It's great for the conversations, networking at its finest. I even love the food buffet. I never eat a proper lunch, and this week I always have my proper lunches. So, speaking of lunch, we have a completely non-scientific, kind of sort of anonymous, but not really, survey for you all right now. So, did you assure hygienic hands before eating lunch today? So, yes, I washed my hands with soap and flowing water. Oh, look at you all. Yes, I used hand sanitizer. Not this time. Everyone was rushing to the food lines. Thank you for your honesty. I knew I'd be using, not this time, because I knew I'd be using a fork and risk was kind of low. No, I didn't think about it. Or D, I prefer not to answer. As we say in the US, I'm taking the fifth. I won't incriminate myself. No D here. So we really know that, and we've said several times already in this session, that the act of cleaning your hands, it's so powerful. It's so simple, yet it's so elusive. Hand washing rates are still extremely, extremely low, despite that protective nature. It achieves our health goals, it helps with nutrition goals, other SDGs like education and sustainability, but with all its benefits, there's about 40% of households don't have any kind of hand washing station. Globally, we know only about 25% of people actually wash their hands after defecation. When it comes to washing hands before cooking food or eating, the statistics get really, really fuzzy. We really don't have very accurate numbers, but we project it's even lower than after defecation. So this is a short highlight for you all, but I wanted to highlight a session that will be happening Thursday, 1:30 to 3 in Azalea, where we're really gonna hone in on hand washing beyond toilets. So really looking to see how can we drive hand washing at those other critical times, and we're particularly honing in on that junction of hand washing around cooking, feeding, and eating. So we invite you, you can see we have a rich set of presentations, but more than anything, we hope it's a conversation. So interspersed with these presentations, we have some activities and some prompting questions. So I hope you can join us. And with that, that's my little teaser, and I'll pass it on to our next spotlight. Thanks. Thanks, Victoria. Would you like this?
No, okay. Hi, everyone. I am, again, Victoria Trinice from the CDC, and I am promoting a session that happened yesterday, but fortunately, everything is recorded, so I highly encourage you to check it out if this is of interest. The idea behind this session, I did not touch that. The idea behind this session, I feel, was really well captured in the panel session at what Na said. Hand hygiene is not just about outbreaks. It's not just about healthcare in schools. It's all the time. And that's really what we want to highlight in this session, is thinking about new community settings. We're thinking about markets. We're thinking about points of entry, places of worship, places where our sector does not have a depth of experience with either research or best practices for implementation. So we wanted to have a conversation about some of those things, including the state of knowledge, the state of policy, and just hearing from practices from the field. So in this session, we explored the existing evidence base on the role of WASH on disease transmission in community settings, community gathering settings, as well as understanding existing global guidance. Jo gave a similar presentation where she outlines the framework for implementation and findings from the systematic review on current guidance that exists for hand hygiene in community settings. And then we had a series of presentations of learnings from the field, including a presentation from our panel presenter here, Maureen Kasande from Uganda, where in Uganda, the first cases of COVID occurred in the long-distance trucking population. And so they used a CDC tool called the PopCab, Population Connectivity Across Borders Toolkit, to identify population movements and the places where truck drivers went to when they passed through countries to identify priority locations for hand hygiene interventions. So interesting exploration of that. A session or a talk on engaging stakeholders in establishing partnerships in these novel community settings, and then some approaches for managing hand washing facilities in community gathering settings. And I think very similar to what Om is going to present on in a little bit. So that's what happened on yesterday. But then we also have a verbal presentation on Thursday in Redbud in the afternoon on factors associated with hand hygiene in community gathering settings in Uganda, which I think will be really interesting to see what factors potentially leads to improved hand hygiene practice, where is it happening, where isn't it happening, where do we need more effort. So I think that'll be really interesting. So I hope you were able to attend those, and I will pass it over to Om to talk about his.
Happy Global Handwashing Day, everyone. My name is Dr. Om Gautam. So I work for WaterAid and I lead the behavior change portfolio. We, as a practitioner and also the researcher in the room, we know that behavior change is a difficult undertaking, but we also know it is possible to do so. We can change behavior if we're able to motivate people, if we're able to make sure that we disturb the environment with cues, nudges, and also placement of facilities, products in place, and if we're also able to change the social norms. We know having facilities are precondition for behavior. It doesn't mean that people will use them, but precondition. Without precondition, people can't practice the behavior. It is in that particular context, UNICEF and WaterAid came together because throughout the pandemic and also beyond, we have been installing public hand washing facilities in various locations, including in schools, healthcare facilities, marketplace, bus stands, religious place, and workplace. So many hand washing facilities being placed. So therefore, we had lots of learning about the functionality, the sustainability, and usability of those facilities. In that particular context, we organized this event this morning to share what have we learned throughout the pandemic and beyond installing those public hand washing facilities, to share our experience. Followed it by, based on those learning, we realized that there is a need for a step-by-step guide, the technological guide that helps the practitioners to use while installing the hand washing facilities. And together with UNICEF and WaterAid, we have developed a technical guide that we also wanted to launch with that particular session. These were the two objectives that we had in this morning session. To meet the first objective, we have launched the technical guide for hand washing facilities in public places and institutions, and it was designed by WaterAid and UNICEF based on our in-country experiences. So there is a barcode you can use to access the document, and you can also find this document into the reception later. This guide has a different, includes so many features. It does have so many features, but then some of the consideration that we're making, part of this guide, some of the things that the practitioners need to use includes the initial consideration before installing the hand washing facility, what the kind of pre-design consideration need to make. It also includes some of the design principles for hand washing facilities. It also includes the technological adaptations. It also includes some of the examples of permanent and semi-permanent hand washing facilities from 12 countries, including the cost. And it also includes some of the technology that we have installed throughout the pandemic, and also has lots of insights about the implementation, management, operation, technical details, including the checklist for accessibility audits, including the monitoring, the longitudinal monitoring aspects. So it's kind of, I would say, step-by-step guide, thorough, comprehensive guide for practitioners to use it on the ground. That was for the first objective. The second objective, based on the learnings from multi-country installing those hand washing facilities in public places, we have identified some of the common challenges and some of the recommended actions for sustaining those facilities over time. Some of the common challenges that we have found, I mean, WaterAid, UNICEF, and other multiple actors has implemented those facilities. The common challenges has been lack of institutional mechanism for ownership and also maintaining those facilities, weak supply of soap and water for daily operation, and also lack of cleanliness, weak or no mechanism for wastewater management, lack of skills to repair and weak design, lack of inclusivity and also the inclusiveness, and lack of visual cues to prompt the behavior and behavior change campaign together. So those are the common challenges for sustainability. If you and your institutions thinking of implementing these facilities in future, I would say these are the common challenges you might face, and therefore need to be ready to address those at the beginning. So based on these challenges, of course, these were the collective challenges that we faced at the beginning of the pandemic, then we subsequently started addressing those from installing temporary facilities to improve more permanent and semi-permanent to permanent facilities. Some of the recommendation includes ensuring a dedicated institutional mechanism and human resources, maybe for operation and maintenance, making sure that the permanent and facilities are being installed, either semi-permanent or permanent facilities. If temporary facilities are installed, there should be its own daily operation mechanism. Otherwise, it will be quite elephant to deal with. We have to ensure the budget. If there is no budget allocated for water and soap, we should definitely take these facilities away. And proper waste management mechanism need to be in place. And then also the local design has to be ready. We need to make sure that we build those design in advance, involving the end users. And finally, we need to have a robust behavior change campaign together if we are implementing these public hand washing facilities in future, including with nudges and prompts. So with that note, I would like to conclude the sessions. Of course, these were the trend from temporary to semi-permanent to permanent facilities that we have installed throughout the pandemic. And those learnings were based on these facilities implemented across many countries. With that note, I'll now pass over to Ron. Thank you.
Okay. Thank you, Joya, Victoria, and and please do join those sessions. You know, over lunch, our discussion was about what a great resource that guide is. And if you have trouble finding it, just go to the Global Handwashing Partnership website. We have a resources hub there, and we'll have that there waiting for you. So again, such an important day, Global Handwashing Day. Such an incredibly effective barrier to disease within our communities and our families. But yet, this simple action, it's still very hard. It's hard for everybody. I mean, anybody who's had kids knows that hand washing is hard. But it takes the full system for us to increase hand washing. And each of you belong to an organization that's part of that system that's so important for this. So please do consider how your organization will move forward and to take your role that the guidelines, the WHO, UNICEF guidelines will point out for your type of organization. Look for how you can advance hand washing in your communities, in your country. Consider joining the Global Hand Washing Partnership. And please do join us next year for Global Hand Washing Day. Take advantage of our resources and consider partnering with us. We have a Creating Clean Hands youth contest, which is a creative contest, and we're looking for different partners to partner with for next year. So if you're interested in that, please let us know. Thank you for joining us today. Please let us know if you have any questions about Global Hand Washing Day or the Global Hand Washing Partnership or anything that was presented today. Thank you for joining us. Happy Global Hand Washing Day.